Falls are a serious concern among older adults. There are strategies to reduce fall risk and programming to prepare individuals to respond safely to a fall event should it occur. Specifically, HopUp PT has created a safe fall recovery video available on the hopuppt.com webpage, which provides detail related to safe steps to getting up after a fall. Education and training to safely recover from a fall is best accomplished through practice. However, practicing getting up once a person is on the floor also requires an individual to first descend safely onto the floor, and it may also require an additional person to get down to the floor. Many times, the skill of a licensed physical therapist is the safest way to practice the skill and to assure the activity does not result in injury. This video aims to provide a framework for physical therapists to assist older adults in safely descending to the floor and to demonstrate a few common techniques to perform this maneuver. When approaching training an older adult to get onto the floor, the therapist should consider the following to assure the benefit of teaching this skill outweighs the risk of harm. First, the therapist should consider, does the older adult have a diagnosis for which getting onto the floor may be contraindicated or increase their risk of injury? And second, am I, as the therapist, confident that I will not harm myself assisting the person to descend to the floor? Let's explore each of these questions a bit more. Prior to getting down to the floor, the unique medical, physical, and emotional considerations of each older adult should be assessed. Specifically, does the individual have any past or recent medical conditions that would require accommodation or suggest getting to the floor is contraindicated? Some examples may include recent knee, hip, back, or shoulder pain or surgery, significant physical debility, and even an individual's stated fear of getting down to the floor. Next, the therapist should consider if assisting the person to the floor may risk harm to self. For example, is the therapist concerned about back injury when assisting the person to or from the floor? Some available tools to reduce the risk of injury to the therapist and the older adult include the use of a gait belt. It is recommended a gait belt always be used when performing the transfer to the floor maneuver, even if the person appears independent. It may also be necessary to plan to have a second person close by to assist with the descent and ascent from the floor. A trained healthcare provider is the best choice if available. However, given this is not always a feasible option in the home healthcare practice environment, a physically capable caregiver could be utilized if the therapist's clinical judgment deems this a safe option. Getting down to the floor is best done from a steady, non-movable object, including a couch or a chair. The lower the starting surface, the less momentum is generated during the physical down to the floor. Using this approach will also decrease the force of impact on the body part that makes initial contact with the floor. For some individuals, initial contact on a single knee is feasible, but it is also worth considering if landing onto a larger area, for example the gluteal region, may be a better choice. Injury with excessive shoulder extension should be monitored, and specifically the required eccentric contraction of the shoulder musculature required to lower the body from the chair to the floor should be considered and possibly avoided. Many times, older adults may state they are comfortable lowering themselves to the floor. If the therapist's assessment findings are congruent with this assertion, the gait belt should be donned, the individual should be instructed to hold a sturdy object during the transfer, and then the therapist can provide contact guarding throughout the floor descent. The therapist should be prepared to assist promptly to minimize impact of the person's body with the floor. This technique may require varied levels of assistance from none to moderate amounts. If an individual has concerns about bearing weight through their knees, or the therapist suspects the person will require more than minimum or moderate assistance, it may be best to choose an approach that has the person descend to the floor from a seated surface. In this approach, the older adult is seated in a low chair or sturdy surface and is instructed to scoot forward onto a stool, pillows, or similar objects that have been placed by the therapist to create a step-like surface for descent to the floor. Multiple items of descending heights may be required to accommodate the person's ability. As previously mentioned, a gait belt should be donned. A therapist's ongoing instruction and assessment throughout the transition to the floor should guide and reassure the older adult. Additionally, shoulder hyperextension and excessive knee flexion should be monitored and corrected to assure safe body mechanics if observed. Alternatively, the person can lower themselves from a stair by sitting on the second, third, or fourth stair and then moving down the steps to the floor. Once the individual is positioned on the floor, the therapist's education on steps to safe fall recovery can begin. While there is no one prescriptive technique for getting down to the floor, an understanding of safety considerations is essential for a physical therapist to make clinical decisions that best meet the needs of each person. If you have questions or comments about this video, please reach out to Hop Up PT through our website contact form.